I'm sure that as your due date approaches, you are getting more into the labor mood and you're asking yourself how this will be for you. I'm sure that you're hoping it to be nice and smoothly, fast and less painful as possible. And I wish you that, absolutely. But unfortunately, there are some situations where this doesn't happen, where the labor stops or in medical terms is stalled or obstructed. So in this video, we're going to see why this happens and how to recognize it when it does. Let's go into the video. Hello everyone and welcome back to my channel. Thank you for coming back if you've been here already, while if you are new, welcome. My name is Ilenia, I'm a midwife. I do weekly videos on pregnancy, birth, breastfeeding, postpartum, so please don't forget to subscribe, and thank you for being here again. So let's talk about what to do when the labor stops and why it might happen. Usually a labor that is stalled is simply a labor that is going long for too long, or it just proceeds slowly. And mind you, it's quite different to understand. It's quite difficult as well to diagnose, and often it leads to interventions, medical interventions that sometimes are necessary, sometimes might not be the best option. But again, it's hard to diagnose. And this is because the last thing that happens is that the dilatation stops and the labor stops. But usually, most of the cases, the problem is actually before that, is inside, is the uterus and the position that your baby is in your pelvis, and is due to the biomechanics of the pelvis. Therefore, if we ask ourselves, where is the baby? Maybe we can do something to adjust it and to let labor start or simply let it go smoother. Why it happens? When your labor starts to contract, it tries to push baby down, and as your baby goes down, they will try to turn and rotate and adjust their smallest diameter of the head with the largest diameter of the pelvis. This unfortunately doesn't always happen as smoothly as we would like it to be. There can be a tight muscle or a contracted nerve or something that just doesn't let baby go down as it should be. It can be reversed, it can be changed, don't worry. But how can you detect it first? Now, a stall in labor can happen anywhere in labor. It can happen before labor even starts. For example, if your water breaks with absolutely no contraction. And again, this is quite normal. Sometimes your labor will start by itself within 24 hours, but sometimes it doesn't, and then it needs to be is advised that it is augmented with some artificial meanings. Or I was saying sometimes it happens during early labor, and I would say is where we see it happening the most. Or why not in active labor, or even while you push. And again, it's always linked to something mechanical, biomechanical that happens in your pelvis with your baby. I would say that the majority of obstructed labor, stalling labor happens in early labor, and this is because your uterus is really trying to determine whether they should start the show or not. So you might happen to have a prodromal labor that just stops and starts and it never keeps going, or like an early labor that is actually quite painful. The contractions are good, they're very regular, but they just do not change your dilatation. And every time you go to the hospital or you call your midwife, you're always at the same point in time. This might be a sign of stalled labor. While inactive labor usually happens when the contractions are very irregular. They are not able to maintain a 3-6 minutes pattern, and they just go all over the place, or they couple, we say. So meaning that one starts, finish, another one starts and finish, and then there is a big gap in between. Those are all signs of uncoordinated contraction, meaning that the uterus is really, really trying, but for some reason they can't succeed in rotating and push this baby down. Another thing that can happen in the late phase of active labor, going to transition, is usually before transition, is a stall around 7 to 8 centimeters. Now, not all the stalls are bad. Sometimes just your body that is trying to give you a break. to rest you. Your uterus maybe needs to rest, your baby needs to rest. And this is where, especially where we medical profession intervene and we give you synthetic oxytocin, or we break the waters, and we actually cause more problem because your uterus was already trying to solve a problem and now we're adding more factor. So it depends. Just be careful when they suggest you intervention while your labor is stalling. It might just be a little break, while if it is actually a more consistent stall, then it's another story. Or it can happen while you push, and for example you have to push for such a long time because your baby just not coming down. Maybe you reach 10 centimeters because you're pushing, but it's just not working and your baby is struggling to come out. For struggling, I mean that they just do not descend. They're not suffering usually, but they are not descending. So how do you solve that? Well, I would say that if you've been following me now for a while, you know that the movement is the key. So you have to keep moving in labor. But again, there are so many more ways to do it, and I can't go into depth in this video because it will take me forever. So please make sure to subscribe to the channel to know more. Follow me on Instagram, where I always give you more and more information about this topic. This is what usually can happen that might let you think, oh, my labor is not progressing very well, there must be something. So act quickly, and before, ask for your midwife support. They'll be able to help you. They should actually recognize themselves the stall even before it happens, so you to think about it. But again, just prevent it. It's better to prevent than to cure. So keep active, move, go to the toilet, keep yourself hydrated, and I'm sure your labor will be as you imagine it. I'll see you next video. Bye bye.